Hello, you're watching Tell It Like It Is with public officials today, and my name is Kathy Benuck. Unquestionably, one of the biggest issues across the nation throughout the past couple of years has been the whole issue of Affordable Care Act, more commonly known as Obamacare. Now, obviously, over the past couple of weeks, we've seen that the rollout has been plagued with problems that presumably, we hope, will be solved. But beyond that, there are multiple issues with Obamacare that continue to be hotly debated. And some facets of Obamacare have already been delayed. Delays are being sought for others by both Democrats and Republicans. We're seeing that with all the news every single day, and it doesn't seem to matter what news outlet you watch or what you read, we're hearing about people receiving notifications that their existing health insurance policies are being canceled, that people are kind of going into sticker shock with the new bills for their coverage, and that hundreds of thousands of people across the country have seen their hours cut, therefore their wages cut, by employers who essentially, I guess you could say fairly, are dodging the health insurance benefit provision to employees. Now, all of these occurrences, in addition to the whole act itself, have people stymied, completely confused, as to whether or not Obamacare should proceed into the future or if it should actually be scuttled by our national legislators. Facets of Obamacare, like expanding Medicaid eligibility and insurance health care exchanges, have led to legislative battles in the states, including right here in New Hampshire. Many of these issues remain undecided as of this date, so we really don't know yet for certain what we all can expect. So, having said all that, today my guest is New Hampshire Senator Andy Sanborn, whose district, of course, includes Bedford. Now, Andy is the current chairman of the Senate Commerce Committee, and he also serves on the Capital Budget Committee and the Health, Education, and Human Services Committee. Notably, for the purposes of this show, Andy has also been a member of the Bipartisan Medicaid Commission that was appointed by the governor a few months ago to attempt to solve how New Hampshire should best deal with this whole subject of Medicaid expansion. So, obviously, Andy is extremely well versed on the whole topic of Obamacare, as well as the impact in New Hampshire on our own people. And since he is our state senator, what more perfect person to have on the show to help us understand the whole issue and all the side issues associated with it, and to unravel this huge issue of Obamacare, particularly as to how it affects us as New Hampshire citizens, what problems in New Hampshire need to be solved, and where it's all going to shake out. So, enough from me. With no further ado, Andy, it is so good to have you back.
Kathy, it's great to see you. Thanks so much for having me back. And all the listeners out there today, thanks so much for tuning in while we talk about what is obviously an incredibly complex question. And it's a big issue, and it's broad. So maybe we start, take a couple minutes.
Nice overlook?
Nice overlook.
Perfect.
You know, what is Obamacare? Who is it really affecting today?
Yes.
And you know, we're seeing a lot in the press. Obviously, you know, the website's now open.
Yes.
A lot of controversy.
Yes.
So I think people, as listeners, I think you're probably tuning into the whole debate at this point.
Well, actually, before I came here, and you probably were too, I was glued to the television watching the congressional hearing in which Congressman went,
Kathy Benuck speaking
quite
today.
Fascinating, yes.
Very fascinating. So let's back up a little bit, Kath. So we need to remember one specific date, which is March 26th, 2010. That was actually the date that Obamacare, or the ACA, the Affordable Care Act, was actually voted and signed and became law. Mm-hmm. Now, we'll come back later in the conversation about what makes that date important. But, you know, what is the ACA and who is it affecting? Now, we've all heard the hype for the past 3 years that it's going to make insurance more affordable, it's going to put more people on insurance. Mm-hmm. But the question always is who are they talking about, right?
Right.
So at its core, the ACA was really trying to find a way to get, or they sold it as, let's say, as an insurance product to allow more people to buy lower cost insurance and allow more people to actually get insurance.
Which sounds wonderful.
Sounds wonderful. But the way they were looking to do that was to mandate by law everyone has to have it. And if you don't have it, you'd have to pay a penalty for it. Now, when we talk about people for insurance, you know, I'll talk in threes a lot today.
Okay.
So first, we have people who have what's called an individual plan. Now, that doesn't necessarily mean it's I, Andy Sanborn, have my own insurance plan. What an individual plan is someone who buys insurance outside of their employer.
Okay.
So an individual plan can be someone buying a plan themselves for them and their extended family. You know, father, mother, 3 kids, 4 kids, whatever.
Which, and of course, New Hampshire, we don't have a lot of choices.
Don't have a lot of choices. We'll get to that.
Right.
And so today there are about 29,000 plans where people have gone out and say
29,000?
29,000 where people have gone out and said, I'm not going to buy insurance through my company. So the second tier, per se, are what we call small business plans. So if you're an employer or work at an employer with less than 50 employees, you're considered in the state of New Hampshire today to be a small business, and it would be a small business plan.
Okay.
And then the third tier would be large employers, which is over 50.
Okay.
Now, I have to caution the listeners today, at some point that number is going to change in about 2 years, that 100 will now be the definition of small.
Really? I didn't know that.
Yes. So we have 3 tiers of people that the government's looking at: individuals, small business plans, and large business plans. Now, we also have to remember that part of that large business are the state of New Hampshire with all their thousands of employees in school systems.
Sure.
Those types of insurance plans are what we call self-funded, which means they're not really buying insurance, they're just paying for their medical care out of their pocket.
Okay.
But again, we see that as very large businesses, and they, to a very large degree, are completely exempted from the whole Obamacare discussion. Other than
Do you think people understand that?
I don't.
Okay.
Other than the fact, we hear a lot about this word called the mandate, that you're mandated to have insurance or there will be a penalty. For individuals like you or I, under an individual plan, that penalty would be $95 the first year, or $695 the second year,
$695.
or up to 1% of your personal income.
That I did not know.
So
I just kept hearing that $95 figure.
95 for first year, 695
Wow.
second year, or up to 1%.
Wow.
So the fees could be rather dramatic.
Yeah.
For businesses, we're talking thousands of dollars per employee if they don't have insurance.
So for the small businessman, this could be kind of devastating, especially if they're on the wire, you know, trying to survive.
Absolutely. Now, part of the kickback and the pushback from the business community and many politicians, they realize that the rollout, we'll talk about that a lot too, the rollout hasn't gone so well.
No.
So they've actually eliminated that mandate and that fine for the business community. But if you're an individual, if you're buying your plan yourself, that mandate still exists.
That does not seem fair.
Does not seem fair to me either, because I'm a guy that really believes in fairness. But I mean, there's obviously a lot of chatter happening these days down in D.C. about whether or not, if you've exempted the business community, should you be exempting individuals?
Okay.
But so globally, again, individual plans, small business plans, large business plans. Then on top of that, we have to remember there are people who have Medicare, those who are over 65, and people who have Medicaid, which are those people who traditionally, and we'll talk more about that later as well, don't make a lot of money and have a medical condition that prohibits them from being able to work full-time and make a lot of money. And we all have an obligation to help those people.
Of course.
So the primary part of the ACA was saying, look, for those 3 groups, individuals, small business, and large business, who have insurance, the federal government came in and said, we're going to mandate everyone has to have it. We're going to charge you a tax or a fee if you don't. Now, underneath that premise, the federal government also said, well, we also believe that the richness of the benefit, Kathy, you know, the benefit of the insurance has to be at a certain level, and we're going to ratchet that benefit up. So 2 years ago, December, every state had to declare what was called the essential benefit package.
Okay.
And that includes the mandates. Does your insurance policy cover hearing aids? Does it cover glasses? Does it cover bariatric surgery or pregnancy? And every state had to make a minimum benefit, which was dramatically higher than what many people get.
Okay.
Now, the upside and the downside is those people who are going to be forced to buy insurance plans today, there will be a richness of the benefit. It will cover a lot of things. But as you know, the more expensive the meal, the more the bigger the richer the meal, the more expensive it becomes.
Not to mention we're all stuck paying for things we may not need.
Many people.
I mean, I will not be having any more children, obviously.
I'm thinking I might not have many either.
Okay.
Right.
So they'll be very, or I'm not planning on bariatric surgery because I'm trying to gain weight.
That's true. So you're right. But it's the thought of concept of insurance that you spread the risk over a large pool. So now we have these three groups of people, and the federal government comes in and says the quality of the insurance has to be of a certain level.
Okay.
Now, then the question comes down to is where are people buying it? And we hear this word called the exchange or the marketplace.
Yes, I want to ask you about that.
Yes,
because
ma'am.
I think people are totally confused about that, or at least some folks are.
So the concept was the federal government says we want to create a government-controlled central processing place that people can come on to, give us all of their personal information, which we're going to cross-check with a number of other agencies. So if you say you make X amount of money, they wanted to be able to automatically verify that with the IRS.
It kind of sounds like Big Brother, doesn't it?
There could be a little bit. For some people,
Sort of.
Some people are pretty concerned about the amount of information that's being required to participate, right?
Yeah.
So they said, we want to, they initially sold it as, we're going to make a website, just like, Kathy, you buy beautiful jewelry and you know what Amazon is. Many people out there, you know what Amazon is. And so we want to make it like Amazon, or we want to make it like Travelocity or Expedia, that you can go on and very easily in 2 or 3 clicks.
Truthfully, what's the prospect of the government doing that?
But their concept was, we wanted to find a way that people could go on to a website, shop for insurance, enter some information, and see what's available to them. So let's talk about what's available to them.
Okay.
So to try and make it easy for people to understand, the federal government said we're going to make 4 different quality levels of plans. Like think about, entry-level car, intermediate, high-end, and luxury car.
Okay.
So we're going to call them the metal plans: bronze, silver, gold, and platinum. So in each of these opportunities you have, there would be different plans with, again, a different richness of the benefit that you could shop for.
And different dollar amounts.
Then there would be different dollar amounts,
Okay.
absolutely.
Okay.
So the concept was people will go online, they'll shop for these plans that have different benefits, and then make an application.
Okay.
So before we talk about the application, one of the challenges in New Hampshire is our minimum essential benefits. We've always had a challenge in New Hampshire that our insurance, as you know, has been very expensive.
Yes.
And there hasn't been a lot of choice.
No, there has not.
Now, that's all essentially been done legislatively. The legislature since 1993 has really restricted who could sell insurance and raised up the bar pretty regularly about what it had to have for a benefit.
Okay.
So where many other states might have a bronze plan, the lower tier, of a very basic coverage. You're 23 years old, you're in college, you obviously think you're going to live forever, so you don't need a lot of benefits.
Right.
And then it would ratchet up. Our minimum essential benefits is very, very high. So for us in New Hampshire, the differences between the bronze plan and the platinum plan really comes down to money. How big is your deductible? How big is your co-payment?
Yeah, and that's a huge issue.
Huge issue. Or how big is your co-insurance? We'll talk about that as well. So the federal government essentially said, and we're actually hearing about this today, we're hearing a lot of people are being actually dropped from their insurance. Now, obviously, that's very contradictory to what the president said. We all remember the president, right? Because it's playing on news every day right now.
Yeah, even his supporters are starting to howl about it.
Right.
Yeah.
If you like your health care plan, you can keep your health care plan.
Yeah.
If you like your doctor, you can keep your doctor.
Yeah.
So where they're kind of splitting that needle is, we go back to the March 26, 2010, the date that was signed into law. So what they're saying is if you still have an insurance plan that predates that March of 2010 date, that you can keep that plan.
Well, how could it? Because you have to renew every year, and almost inevitably there'll be some kind of change.
About 70% of the plans in the market today you're right, have changed since March of 2010.
Yeah.
So the universe of people who have what we call grandfathered plans is very small. So
it would seem it would be.
It would be, because we shop for insurance every year.
Of course.
And our agent comes to us and says, hey, look, there's a new plan. It's going to go up 30%. But if you change your deductible, you change this, you change that, we move you to a different plan, it's going to save your money. 70% of the people have been doing that. Only 30% were like...
Particularly now, with all the other economic challenges everybody's facing.
Exactly. So the challenge is, any plan that existed after the March 26, 2010, until this October 1st, when the ACA rolled out, no longer qualifies.
Wow.
So they're canceling plans. But let's be specific about who they're canceling.
And some of the states are announcing huge numbers of the people being canceled.
Some states have large populations, absolutely.
Yeah.
But let's not scare everybody, because this isn't something everyone should be scared about.
Right.
Because if this is really affecting people with individual plans. It's not affecting small business plans. It's not affecting large business plans.
Okay.
But it's a lot of people. There are some estimates of 20 or 30 million people in America in the past couple of weeks have been sent letters saying that they've lost their insurance.
Wow.
Because
That's
that
huge.
plan no longer qualifies. That's a lot of people.
Any guess on how many in New Hampshire?
I'm guessing about 30,000.
That many?
Yeah. Have been given letters that say, look, your insurance plan no longer exists. You're going to have to find a new one. So what does finding a new plan really mean? It means that people are going to have to call up. The first thing I tell everyone, call up your insurance agent. There's a lot of great agents out there. You know the senator before me, Senator Ray White, Cornerstone Benefits. I'm actually doing an advertising plug on BCTV. There's some great agents out there that you should call your agent, because they still know more than anyone does about this kind of stuff, and they're a wealth of information.
Well, yeah. I mean, the average person, you read these policies.
Complicated.
And, I mean, by page 2, you're kind of scratching your head saying, what are they saying?
Yeah, right. What is this, and how does it work? And I don't understand.
Yeah.
So first thing, call your agent. And then you have to go shopping for a policy. Now, what we're finding out today, that even if you can get onto the website, that it's a different universe today. So I'll give you an example of a constituent. Someone here in Bedford calls me up and says, hey, look, Andy, I have an individual plan. I'm paying $750 a month. And very important for people to also remember, they need to think about what their deductible is, what their copay is, and we'll see a new term out there called co-insurance. It's going to be very important in the discussion.
Co-insurance.
Co-insurance. So they say, I'm paying $750 a month for my plan. So I go onto the exchange, can't get onto exchange. I call up my broker. My broker figures it out and says, well, they get the same. So this person has a monthly payment of $750.
No small piece of change.
No small piece of change. $1,200 initial deductible, $15 copay, and zero coinsurance. The same plan today underneath the ACA is $1,270 a month.
Wow.
With a $5,700
Wow.
deductible, with a $40 copay, and Obamacare allows insurance carriers to create this new thing called coinsurance. So for some services, and I can't tell you what they are, call your agent. For some services, they're going to make you pay a portion of the cost of that service. Let's say you need a kidney. Now again, I'm not saying, ladies and gentlemen, it is a kidney, but let's say a kidney costs you $100 grand, and the insurance carrier can say, well, for kidney replacement, we're going to co-insure at 50%, which is what the legal limit is.
Wow.
So we are really facing some real concern people should have about the true cost of life under the ACA.
I mean, if somebody wants to call me politically biased, feel free, but it's not sounding good to me.
Well, I mean, for me, the frustration continues to be, and I say many of us small business owners were very concerned about this. We've been talking for the past 3 years about, we're concerned it's not going to be what they promised. We're concerned it's going to be a lot more expensive. And to a large degree, that's coming true. And people are upset, and at some level, they probably should be.
Well, yeah. I mean, this is mind-boggling, really.
Yeah, and people are concerned. So let's.
I mean, I think I stay current on issues, and I certainly read. I get news from so many sources that it's incredible. But I've heard you say at least 3 things today that I was not aware of. And I'm a news junkie.
Right, it's complicated. It
Yeah.
really is. So let's talk a little bit more about some specific issues we're seeing in New Hampshire. Now, we know back to 1990.
Do we have any idea? I mean, I know Kelly Ayotte has written letters to the National and Sibelius and everything else trying to get numbers in terms of, I guess, both how many people have tried to get on the website from New Hampshire and or how many people have actually signed up. And they're saying these numbers aren't available, yet I heard this morning testimony saying the vendors say, yeah, it's available, but the government's holding it back. Do we have any clue at all in New Hampshire?
You know, we don't, and you're right. I mean, at some level, you know, everyone out there, you all go on the internet, and there's large-scale database addition, think Excel spreadsheets that keep tracks of your clicks and where you go.
They can tell how long you're looking at a page, for goodness sakes.
No, the numbers are there. They just don't want to release them yet. But some people say, well, why is it so important? Why is U.S. Senator Kelly pushing so hard to try and understand? Because remember, part of the implementation of the ACA is there's a lot of dates that are involved.
Yes.
We know that this whole thing opened up October 1st, so we're now a month into it. But one of the parts that was sold about Obamacare was you can never be denied insurance.
Mm-hmm.
Well, that's not technically true.
It's not?
And we're hearing a lot of not technically true statements from the president today. You can't be technically denied. Here's one of those criteria. Mm-hmm. The window of which you can buy mandated insurance, so you have to buy it, but the window to buy it is only open from October 1st to March.
That I did not know.
Only this year. So if you don't buy it by March, you can't buy it.
You're out of luck?
Totally. You're out of luck.
Wow.
Now, if you change employers, there's a couple exceptions to it.
Yeah.
But the window goes from October 1st until March. So if the website's not working, if people can't get on, it's making it difficult to buy something that the federal government is mandating by law that you have to buy, and if you don't buy it, you're going to be taxed.
All right, the practical side of it, even if the website is working, what if somebody right now who might be out of work or have some unusual expenses can't afford it, but 5 months down the road say, God, I'm going to have to take care of this and want it, they won't be able to get it?
Starting to see some challenges with very selective, because today, someone who has individual coverage can buy it whenever they want.
Yeah.
So it actually is available 24/7, 365. Yeah. But underneath the ACA, there's going to be specific windows. So this time is October 1st to March. And then going forward, it will be October 1st to December 15th. So only for 6 weeks a year will you be able to actually buy what they're saying is insurance you cannot be denied for. So it's forcing a lot of us politicians to say,
kind of a contradiction.
Kind of a contradiction.
A little, huh?
It's government. They do that from time to time. So we're really trying to make sure that the reality is we can no longer debate if we should be doing it. Mm-hmm. It's law, right? It's law. It got passed by the House and the U.S. Senate.
Is there any potential, I mean, we're hearing so much of an uproar, is there any potential that the national legislators will say, you know what, we need to repeal it?
I mean, I think there's always a chance, but to do that, we would need a Senate that would be Republican-controlled, and we'd need a Republican president.
Well, yeah, that's true, because he'd veto.
So today I'd have to say there's no way to do it. But there are things we can do, and when we wrap up at the end of the show, we'll talk about the fact there are other solutions that are available to us. So today we've got this issue that the thing opened up on October 1st, and as you've heard, many people are very frustrated.
Because today's October 30th.
Because they can't get on.
Yeah, exactly.
I mean, think about if Amazon, it's Christmas season, that you want to go buy presents for your kids and they won't let you log onto the site. Now think about it, if the government mandates you have to do it and they still won't let you sign on to it. So there's no question that the site isn't prepared to handle what it is. The other thing that frustrates me, and it should frustrate all of you listening out there today, I think if the government tells you have to have something, you should have the right and the ability to go look at it first before you make any buying decisions. And they actually specifically turned off your ability to do that. So now you have to give the government all of your private information, tell them your income, and do all your sign up before they'll let you shop and compare what the policies are that you might be able to buy.
Now, this seems like a good point to kind of throw in a question because it's all related. One of the promises was that people will be able to keep the same doctors and such. But yet right here in New Hampshire, we saw Anthem, which, you know, for all intents and purposes is about the only health insurer in the state of New Hampshire. We saw the announcements that worked up a lot of people that they've cut some of the hospitals and physicians groups in New Hampshire out of their system. So
What's going on? What's going on, right?
Yeah, does that not mean that, like, for example, people in North Country are going to be forced to travel great distances for hospitalization if they want it paid for by their insurance and so on and so on? I mean, to me, and again, I'm not an insurance expert or an expert on any of the things we're talking about, but this seems to me like this is pretty bad for a lot of people in New Hampshire.
Kathy, you're asking a great question. You know, the word that comes to mind is called rationing.
Yeah.
You know, like everything wrong with what America is all about.
Yeah.
So the short answer is yes, but let's talk about why. So when the federal government said we have to make all these new policies and we have to redefine what the richness of the benefit is and who can get them, you bring in people who can do a lot of good addition. They're called actuaries, who do a lot of addition, and say, all right, the benefit's much higher. The people who will be buying the policy now have a different demographical makeup. They could be older, they could be less healthy. So we think there's going to be a cost to comply with these new plans underneath Obamacare. So what Anthem realized was they suggested that the cost of their plans were going to go up 35 to 45% on and above the increases we've been seeing for the past couple years. So Anthem came back and said, you know, look, you know, there's ultimately that straw that breaks the camel's back.
Okay.
So as opposed to raising rates, we need to find a way to try and keep rates lower so we can try and show people that government mandated insurance might not be so expensive. So we all understand some basic economics, supply and demand, right? If you're at the Red Sox game tonight and there's only one beer left on the shelf, people will be willing to pay a lot for that beer.
Yes, they will.
But if there are tens of thousands of beers on the shelf, they can only charge so much, knowing they have to sell them at the end of the day. Supply and demand. So the insurance carrier, Anthem, and you're right, Anthem sells 76% of the business written in this state. We have one insurance carrier that does all that. So Anthem went to a bunch of hospitals and said, look, if we drive a lot more business to your hospital, will you be willing to accept a lower reimbursement rate on the services that you provide? And so we have 26 hospitals in our state, and Anthem negotiated, and at the end of the day, they found 14 hospitals willing to take a lower rate for more volume. So we've cut 12 hospitals out of the pool that people can go get insurance for. Now again, let's be specific though. It's just this individual group market. So individual market of people. And if you're a small business owner, under 50 employees, and you buy your insurance specifically in the exchange, that group of people are going to only be able to utilize this new, what we call this new narrow focused network. So what does that mean?
It means to me that the promise that you can keep your doctor kind of just flew out the window.
There's a lot of chatter today, as you're seeing in the news, that the president keeps saying if you liked your insurance, you could keep your insurance. You like your doctor, you can keep your doctor.
They keep showing multiple news clips of him saying that.
Because that's how he sold Obamacare.
Yes.
And now we know that that's not the truth, that the president just didn't keep his promise. That one of the most controversial, difficult decisions people made, that you can't keep your doctor and you can't keep your hospital. Now here in Bedford, ladies and gentlemen, you know, we still get CMC, we still get Elliott, they're within the network.
Yeah, we're reasonably safe here,
We are, but you know, people know that I represent Peterborough, New Hampshire, in the Monadnock area, and that's a hospital, only
Is that hospital out?
Out.
Really?
Concord Hospital.
Yeah,
Out.
and that's a big hospital.
Big hospital. So we're seeing that for many people with individual plans and small business plans buying within the network, that their choice is truly going to be limited. So let's go back and talk about the threes again, right? So all these insurance plans that can be bought, you have the plans that existed before March of 2010. We'll call those grandfather plans. You renew it every year, go to whatever doctor you want, wherever, however, old style plans. then there are insurance plans that you can buy outside of the exchange or the marketplace. So you can call up your insurance agent and say, look.
So the exchange, is that just another word synonymous with marketplace?
The exchange is like a shopping mall.
Okay.
It is a shopping mall.
Okay,
You can
good,
go there
because
and buy
again, I
stuff.
think that's another term that has confused
Because many people think you have to go to the exchange to buy insurance, and you
yes.
don't.
Okay.
You either have it in this old grandfather plan.
Okay.
You can call up your agent and do a plan that's outside of the exchange.
Okay.
Or you go into the exchange and you can buy in there.
Okay.
Make sense?
Yep.
So so some people would say, well, Andy, why don't we just tell everyone, go buy your insurance plan outside of the exchange? Challenge is, A, that if you buy an insurance plan outside of the exchange, the federal government has established subsidies to anyone that buys insurance inside the exchange. So if you make up to...
But no subsidy to somebody who does not buy within the exchange?
Correct. You'd think there's some questions there about the free market, right?
Sort of, yeah.
That if it's good here, it should be good there.
Yeah.
But the federal government is specifically saying, well, it's not so good unless you buy it where we want you to buy it and how we want you to buy it. So they're going to give subsidies, and it's up to 400% of the federal poverty level. So a family of four making up to $90,000 a year, the federal government's going to be giving them a subsidy to buy insurance, but only inside the exchange.
Wow.
So on one hand, we sit there.
Pretty intriguing.
On one hand, we sit there and say to people, "Wow, I mean, making up to $90,000 a year, the federal government's going to give you back money if you buy insurance." Of course, I always say, "Well, where's the money coming from to give the subsidy?"
Yeah, everybody seems to forget federal money is our money.
It is
it's
our
like,
money.
a lot of people see it as manna from heaven, and
it's actually manna from the right side of your pocket versus the left side of your pocket.
Yeah, really.
So there are subsidies available, going from 100% subsidy. So you can go onto the exchange making $27,000 a year and have the potential to get free insurance paid for by tax dollars, up to $90,000, and obviously the subsidy is going to come down during that time.
Okay.
But if you buy outside the exchange, no subsidy.
Wow.
Even though it's available to you.
Now, that kind of brings up, we keep hearing the argument in New Hampshire. Are we going to be part of the national exchange, or are we going to have our own state exchange? And there's legislation and everything else dealing with that.
What is all that stuff?
Exactly. What the heck does that mean?
All right, so we go back and we talk about the exchange. What is the exchange?
Yes.
So today it's called the exchange, or it's called the marketplace, which is this website people go to do this shopping and looking for insurance. The website that's not working today. So when the federal government made...
We have to kind of keep saying
I mean, I shouldn't be laughing at them. I think I'm laughing with them.
But it is. I mean, it is kind of ludicrous,
we spend
really.
hundreds and hundreds of millions of dollars to make a website that doesn't work. When any 13-year-old can make one a night, but let's not go there.
Yeah, the average kid seems to be able to do more, yeah.
Right. So when they created the ACA, the federal government said, look, we want states to make their own exchange and control it. And if you don't make your own exchange, we're going to make one for you. Again, part of this whole mandate of Obamacare. Now, in New Hampshire, it was a hotly contested issue, and I was kind of in the middle of it.
And it's not settled yet, right?
No, it is settled.
Totally? Okay.
Settled. We had a lot of robust discussion and debate about who should be in control of it. Now, on one hand, people know that I really believe in states' rights. I really believe in local control. But for me, the definition of local control means I get to control the decision-making. In this case, the federal government came in and said, we'll let you make the website, but we're going to tell you absolutely everything you got to do and everything that's got to be in it and how much money you got to spend.
Okay.
Or we'll spend the money and we'll make it and we'll just deliver it. So at the end of the day, for me, I'm like, look, the federal government says you need to build this, and you can do whatever you want, but in reality, you can only do what I don't want to do, and I want to do everything. So we said, look, it's going to be expensive, so why don't you just build it, because we don't have a lot of faith or belief in what you're trying to do. We're very concerned for the taxpayers. And when I say taxpayers, how expensive can it be to build a website, right? That's one of those first things we say all the time.
Yeah.
Because your 13-year-old kid's building one every night.
Yeah.
Going in the garage, selling the tennis racket, the skis, they're making it happen. So in this case, we know the federal government has spent about $400 million building this website, which we know isn't working virtually at all.
That alone is just staggering to me.
Yeah.
That figure. I mean, when I hear, and is that really the total figure, or are we going to see that keep bumping?
I'm thinking it's going to keep going. Because for comparison, Vermont has made the decision to make their own website. They've gotten $171 million in federal grants to build their own website.
Good grief.
Now, as of 2 weeks ago, after spending $170 million just to build it, that doesn't talk about what it costs to operate it on a daily basis, only 700 people had signed up for insurance through it.
Wow.
Pretty big investment.
Value for buck is pretty low.
Yeah.
Wow.
So in our case, we said clearly, look, if we can control it, if we can manage it, if it's not going to cost the taxpayers more money, be happy to talk about setting up a state-based website. But if you're going to tell us everything we have to do, and we have concerns about what you want to make us do, and we really can't control it, we'll do the federal one. So we're one of 38 states. So only 12 states have made their own sites. We're one of 38 states that have said, look, federal government, you think you're so much smarter than we are. You do it and deliver it to us. Now that's what we're seeing today, is this federal website that if any of you have had the opportunity, I think it's called healthcare.gov. If you're listening tonight, go on, try and sign on, see how it works for you. So you can go on to healthcare.gov, and that's this universe or this marketplace to buy insurance. Now we get back down to all these challenges that the federal government won't even tell us how many people have signed up. So to make Obamacare financially viable, the federal government has said we need, I think it's 7 million people to sign up every month.
7 million every month?
7 million people a month have to sign up and buy insurance. It's pretty big number.
That's a hefty number.
Big number. And we don't know the numbers because the federal government won't tell us what it is. But there's probably only one reason for that. Because if you're the head of the class, if you're exceeding every expectation, chances are
you bark about it.
You bark about it.
Oh, your family does. Somebody does.
Someone does. Ad in the paper.
Yeah.
So obviously there's this concern that no one's really signing up for it. And they don't want to talk about it.
Well, I mean, I hate to sound negative, but wow, I mean, that thought certainly crosses my mind.
Yeah, so I think there's a lot of hurdles in front of the president to set this thing up. They needed to build a website that was easy to get into and people could get in and shop and move around. Andy,
what scares me is, to me, it seems more of a political issue than it does really an issue for all of the people in the United States.
I mean, obviously there's a political, today we're really seeing what some people have talked about, that there is a political agenda, that the Obama administration wants people to buy their insurance only from the government and let the government control it. Nationalize healthcare. We're actually seeing it.
Yeah.
The challenge is obviously their delivery of the opportunity isn't coming out so well. Can't get onto the website, not giving information, costs dramatically
That's scary
higher.
Because jumping forward, what is it going to mean when it is fully implemented in terms of getting a medical appointment when you need it, et cetera, or you need surgery, or you're going to be able to have your doctor book it and a week later go in and get that necessary surgery?
Right.
Or are we reverting to, reverting is probably the wrong word, are we going to a situation that we hear all the time, that exists in places like Canada and England, where they're coming here for their medical care because they can't get it fast enough in their countries?
You know, Kathy, you're asking a great question. I think there are two things to consider. Because you're right, at some level, everyone talks about if they can't build a website, for crying out loud, they can't build a website
well,
that lets you buy.
That's what I feel.
How can they manage the delivery of
that's
the
what
product,
I feel.
Right?
Yeah. I think the website's the smallest part of the problem.
I think we're going to find at the end of the day the website's going to be the smallest problem. Because the other two bigger issues are, comes down to if they do what they say they're going to do and get these millions of new people onto insurance, are we going to be able to get in to see our doctor? Do we have the capacity? Are there enough doctors to see all these new potential patients? And the other part of the conversation really comes down to is how we're paying for it.
Well, now, since we're delving into that, let's get down to the local aspect, because I know you have been so involved in this. We know the governor appointed the special commission to study this whole expansion of Medicaid, which I don't know that people understand what that itself means, expansion of Medicaid. You were on the commission.
I was.
Because you were one of the people who were most active in the whole subject as a state senator. So, let's transition a little bit to that, so that people, first of all, can understand what is meant by expanding Medicaid. As a commission member, you sat there and you heard conversations we'll never read about. One of my questions is definitely, was the commission equally comprised of Democrats and Republicans from New Hampshire? And obviously now the big question is, can you explain to people, in a way they can understand, what it is the commission now will recommend that the legislature act on? And I would be surprised completely if you, or maybe anybody on the commission, totally agreed with what these recommendations are. So I'd like to hear what your concerns are as we're moving forward, because in a couple of weeks, I guess the legislature is going to be called back into special session.
Next week.
So we need to know this stuff.
All right, so let's start with the basic premise, because everyone gets it confused.
Yes.
Medicaid versus Medicare.
Yes,
right?
absolutely.
And they sound so similar, people don't really tune into it.
Yep.
Medicare is insurance or reimbursing for services of anyone over 65 years old.
Right.
So if you're over 65 years old, none of this affects you.
And everybody over the age is eligible.
Everybody over the age 65
income,
is eligible.
etc.
Correct.
Right. Okay.
Medicaid, CAID, was established in 1965, was a way to say, look, we all have an obligation. We have a moral obligation to help people who are truly in need and cannot care for themselves. So they set a program that
Which I don't think any of us have opposition to.
No one has I don't think anyone has opposition to it. And we all believe it's part of the moral fabric of our country, that if you truly need help, we should be there to help you.
Absolutely.
Now, we should always be thinking in the forms of trampolines versus hammocks, help people get up onto their feet, not up off of their feet. So the program essentially said, if you are poor and if you are disabled, you couldn't work for a living, you couldn't make any money. It had to be two things. Poor and disabled, we would be there for you, and we'd pay for your medical expenses. And it went from people that made no money whatsoever up to about 65% of the federal poverty level, which means you made about $10,000 a year.
Which obviously today
isn't a lot of money.
Doesn't get you anywhere.
Now, over the years, we have dramatically expanded that program. The legislature's come back and said, well, if you have a baby, we should cover you. If you're a woman and have cancer, we should cover you. So today there are some populations that we cover essentially all the way up, 400% of poverty level, making $100,000 a year, we're still giving you free care. But again, you've got issues.
They may have extraordinary circumstances.
Extraordinary circumstances. You're really sick, you're really disabled. And I think everyone has a level of comfort with that.
Of course.
So today we have about 130,000 people in the state of New Hampshire, 10% of our population, that are on Medicaid.
It is that high?
Yeah. And we're spending just over $1 billion a year. Half of that comes from your local tax dollars. Half of that comes from your federal tax dollars.
That's a lot of money.
Per year, it is a lot of money.
Yeah.
So as part of Obamacare, so Medicaid expansion is part of Obamacare.
Yes.
They said, look, the way it's constructed, that the president said anyone who makes under 138% of the federal poverty level, about 25,000, you must expand Medicaid and just give them free care.
Totally free.
Totally free care. Which ironically also means any doctor, any hospital, which we're seeing that we're denying people who have to buy their own insurance today that same right. So that's an issue that I have. Now the Supreme Court made two big tests when we talked about whether or not Obamacare was constitutional.
Okay.
Is the tax a tax or a fine? That $95 tax. And can the federal government tell states they have to mandate them to expand Medicaid because there's an expense to it, be an unfunded mandate.
And did they not decide that states do not have to, correct?
They came back and said you cannot compel states to make this expansion because it's going to cost a lot of money. So today we know that 26 states in America have said it's too much money, the program doesn't work very well, it has a lot of fraud, it has a lot of abuse.
We know that, and we know that exists in New Hampshire.
We know it exists in New Hampshire. So 26 states have said, you know, we hear what you're saying, but we got to clean up our sandbox before we go out and play. Let's fix the program before we consider expanding it. About 18 states have said, let's do it because it's government money and it's free. And we're one of a handful of states.
There's no such thing as free government money, for crying out loud.
So 6 states have come back and said, hey, look, let's study it. And we were one of those states.
Okay.
Because this is a state that we believe in helping people. But we also have to make sure we're doing it right. So even though the governor was heck bent to go do it right away, in the House of Representatives...
Yeah, she's a big supporter, right? To jump right in.
She's a complete supporter.
Yes, that's what I thought.
And the New Hampshire House today is controlled by our friends on the other side of the aisle, the Democrats.
The Democrats, yes.
They said, heck yeah, let's just go do it. The Senate's majority Republican, and we said, look, this could cost taxpayers.
Majority by what, 1 vote?
By one. By one. It could cost us a lot of money. So maybe we need to study it. Maybe we need to look at fraud, look at abuse, and see if there's a better way to do it.
Well, that sounds totally reasonable to me. I mean, I don't want you guys up there just kind of giving blanket approval to something without asking a whole lot of questions.
Absolutely.
I mean, that's me. Now, maybe other people listening don't feel that way, but, I mean, if you're going to run for office, I kind of expect you to watch out for me, watch my back.
Well, you know I'm known to be a really frugal guy.
Yeah.
I mean,
some people say you're cheap.
Well, some people might say I'm cheap, but ladies and gentlemen, if it's your tax dollars, I'm frugal. I just want to make sure that government's spending your money as wisely and as efficiently as I can, and that's a big driver for what I promised people that I would do for them as their senator. So we created this commission, which I was a member on, because as you know, I sit on every healthcare policy and financial committee we have in Congress.
Yeah, I know.
So I've kind of
that's
become
one of the reasons that I wanted you as a guest, not
right?
to mention you're our own local senator.
Now the downside is the commission was weighted from the first day.
It was.
It was weighted.
Okay. I mean, that's what I thought, but I wasn't reading it in the paper. Everybody was kind of hands off.
The more people on the commission that want Medicaid expansion unrestricted than there are that said, let's wait and look. So we knew what the result of the commission would be from the first day.
Well, yeah, if it's weighed.
And Kathy, I got to be honest with you. I mean, you know, I've only been a state senator for 3 years, and I'm a business owner first and a politician second. But I spend every day up there trying to represent the people of Bedford and Senate District 9 as well as I can. I have never seen a commission which was so one-sided from the first day in anything I've done up there. So it was a frustration for me.
Well, Charlie Allinghouse, I don't know, a few weeks ago, had an editorial op-ed in the Union Leader that he basically said exactly that. And, I mean, whether or not you agree with his politics, I'm sure a lot of listeners do, and I'm sure an equal number don't.
Yep.
He's still a pretty practical guy.
Charlie's
and, I mean, he doesn't make up stories.
Charlie's a good friend of mine.
Is it? Yeah.
Because we're both kind of that Yankee frugal thing.
Yeah, definitely, yeah.
You know, he's way better looking. He's way better looking and much smarter than I am, but he's still my friend. And so we were both...
You like him anyway, huh?
I still like him anyway. And we both sat on this commission, and it was frustrating because, you know, the results were pre-printed, as we would say. But we were, you know, so 3 months of this commission really weren't very productive. But the final 2 weeks when we were actually doing the negotiating, there was some productive conversation, and even the commission said we shouldn't be doing Medicaid expansion as the governor wants us to do it.
The whole commission felt that way.
The whole commission felt that way. That
even her hand-picked
people,
appointings.
at the end of the day,
That's
after we heard all the evidence, everyone said, you know, we need to try and create some controls. We need to try and look at outcomes. We need to try and find a New Hampshire solution that recognizes people only have so much money. And what happens if the federal government decides not to pay their share? Now, again, we get back to that point where today the federal government pays 50 cents of every dollar. Half local taxes, half federal dollars. So to entice us, the federal government said, if you expand, we'll pay 100%.
But only for a limited amount of time.
Only for 3 years.
Okay.
And then after that, we're going to do what I call taking the dog for a walk, Kathy. Right? We're going to walk at our house and we start walking down the street with the dog. So over the next 4 years, they're going to be paying less and less and less and less.
And it all shifts to us here.
Every penny they don't pay is a tax we're going to have to raise to pay our share.
Do we have even a guess as to what that's going to cost?
Well, here's the consideration. The Medicaid expansion population, we think is going to cost about $340 million a year.
Because why? How many people are going to be added?
So we're looking at about 60,000 people. So
More in New Hampshire
more in New
on the
Hampshire.
Medicaid roll.
So we'll end up with 200,000 people getting free health care with yours and my tax dollars.
Wow.
And some people would say...
That's big. That's huge.
It's not that it's just big, but the population they're looking to expand, the 60,000 people, are people that don't have physical capacity issues.
And don't some of them already have existing health insurance?
Able-bodied people who are working. Childless, so this population is specifically childless adults who are able-bodied and working.
And have, by choice or otherwise, health insurance.
We think about half of them have private insurance.
Well, why would we move them to Medicaid that we're going to pay for?
Because the federal government wants us to.
Well,
So,
you know, it kind of makes your head explode.
well, I mean, you know, it just shows some of the challenges we're facing today, and trying to understand what the federal government wants.
Yeah.
What they want. So we're looking at 200,000 out of 1.3 million people in our state getting free insurance, of which this 60,000 person expanded population are able-bodied working people, half of which have insurance, and they want us to give them a new Medicaid insurance.
Well, that flies against the whole original purpose of Medicaid that we were all okay with.
Many people would suggest that's a true statement.
Wow. And dollar-wise, we're looking at...
So again, we get back down to this $340 million
Yeah.
per year, and the federal government says we'll pay 100%.
Is that a conservative number?
That's a great question, because we don't know.
But it's a number that could continue to rise annually, couldn't
A
it?
couple things could happen. It could not be 60,000. What if it's 160,000?
True.
We don't know how big
Yeah,
the population is.
True.
We know a couple other states, Maine
True.
and Ohio, have done this type of expansion, and
Yeah.
their numbers were dramatically higher than they thought they would be.
They were?
Much higher and much more expensive. Ohio, it's a much bigger state than ours.
Yeah.
They budgeted $2 billion for their Medicaid expansion,
Yeah.
and the first year was $8 billion. So they ended up having to cap the program.
A $6 billion difference?
$6 billion difference. 400% difference. So it raises concerns.
Yeah.
But now that this
Well,
is...
I mean, doesn't that open the door? And I don't need to keep interrupting you, but now I'm getting riled up. Does not all this open the door? I mean, frankly speaking, we don't have the money in New Hampshire. Does it not open the door or lay the pathway for state income tax and/or sales tax?
You know, I have never, since I've become political, used that as like, if we do this, we run the risk of an income tax.
But I mean, being realistic.
But for the first time in my life, right, $340 million, if the federal government comes in, and the president actually said in 2011, the president, the biggest cheerleader for Obamacare there is, Obama said, in order to balance the budget, we need to talk about cutting Medicaid reimbursement rates. Now, he subsequently backed off of that statement, but you go YouTube it, it's online.
Medicaid reimbursement rates to doctors and hospitals?
Right, to New Hampshire.
Whoa.
So he has specifically said it needs to be on the table. So I guess the question comes down is, do you trust your government today?
Me?
I mean,
personally?
well,
no. And, you know,
So-
I mean,
so-
I'm sure I'll get emails about that, and people will say I'm a biased whatever. But no, I don't trust government today.
Well, in light of the fact we know that the president today
Yeah.
is in kind of a tough spot because he kept saying we could keep our policies and we could keep our doctors. I mean, you know, Joe, I forget what his name is, the representative, was it Joe Wilson, when he yelled, you lied.
Yeah.
Well, maybe Joe was right at the time because the president clearly didn't tell the truth about people's ability to get and keep their own doctors.
And
So-
you know what? I really don't give a damn whether he did that deliberately or he did it because he was a victim of his own grandeur. The fact is, we didn't get the truth.
Well, the fact is, what the president sold Obamacare for is not what he's delivering.
Exactly.
On. So how can I, as someone who's just a steward of all you people in Bedford and your tax dollars, you want me to watch and be careful of them, how can I trust what the government says today that they're going to pay 100%? Because here's the rub. If they
There's more.
well, it's just at $340 million.
Yeah.
If the federal government comes in and says we can only pay 50%, which is what they're paying the rest of the program for today, we'd have to find $150 million a year.
But we don't even know. I mean, there is not a future plan, correct, as to how that number could change as to their payment?
Today, the government says they'll never pay less than 90%.
Yeah, but that could change. I mean, we all know that.
Every legislature can make that change.
Yes.
So, for example, we only raise about $230 million a year on taxes in the rooms and meals tax. Our rooms and meals tax is 9%, highest rooms and meals tax in America.
Yeah, I know that, yeah.
So in order to come up with the 50-50 match from the government, for example, we'd have to raise rooms and meals tax from 9% to 17%.
Oh, that'll do a lot for the tourism industry we depend on.
That's how big the number would have to be. So you're right. So I think we need to be exceptionally careful about taking more federal money with their promise that it will all be okay forever and they'll pay it forever because they're $17 trillion in debt.
Yeah.
Our federal government's bringing in about $2.4 trillion a year, but they're spending $3.8. So we're adding $1 trillion every year to the debt, and yet they want us to spend another $1 trillion expanding Medicaid, and I just don't see where the money comes from.
Well, that's what scares me.
So I know we don't have.
I mean, it all sounds, if you just look at it philosophically, it all sounds wonderful. If we all live in la la land, it's great. But, at the end of the fairy tale, you have to analyze how much is truth, how much is fiction, and how much is wishful thinking.
Right. So I know we don't have a lot of time left. So let's talk about solutions.
Oh, wow.
Oh, we're almost
at that.
So real quick, we have solutions.
Yep.
And we only have a couple minutes left, so I can't get into all the details.
Not even a couple.
We have solutions. There are things we can do to save people money. I mean, we need to try and help those.
Can you, if they're, involved, can you come back and we'll do a part 2 on the solutions?
Happy to come back and do a part 2 to talk about the fact.
And we'll do it right away so people can segue right into the next show.
Be happy to talk about how we fix it.
All right.
So do your wrap up.
Yeah, I mean, unbelievable. I knew that we would have no trouble going through that hour. I didn't think it would go that fast. Everybody, if you have not been paying attention to this issue, the time has come now where you have to, because now it is affecting us here in New Hampshire. You just heard me ask Andy to come back. As soon as the cameras go off, we will set that date so that after you watch the show, you'll very quickly be able to see part 2. Meanwhile, pay attention, read the papers, watch the TV news, both locally and the rest of the country, to follow this. As always, thank you for watching, and we will do everything we can to tell it like it is on this extremely important issue, or issues if you have it that way. Thanks for watching. Till next time, bye-bye.